Public health is really important in the field of all non-communicable diseases and definitely in the field of mast cells. So the classic definition of public health is the science and art of preventing diseases, prolonging life, and also promoting health. And in fact, the basis of public health is the ability to analyze the determinants of health, including commercial determinants and social determinants of health, and to learn what are the threats that the society faces in terms of health and how we can overcome these threats. This is an interdisciplinary or even transdisciplinary field that involves many experts from many disciplines, including epidemiology, biostatistics, social sciences, management of health services, mental health, behavioral health, nutrition, and more and more. And this approach is extremely important when we want to deal with liver health.
Good morning. My name is Jörn Schattenberg. I'm the director of the Department of Internal Medicine, Gastroenterology, and Hepatology at the Saarland University Medical Center in Hamburg, Germany. Steatotic liver disease is an increasing public health threat. Clinicians are struggling with the risk stratification and management of the increasing number of patients that are affected. Researchers are currently developing novel biomarkers to support that risk stratification and treatment options for the active pharmacological management of these patients on top of the urgently needed lifestyle management in these patients. The general population and politicians need to be empowered and educated about this disease to allow for preventive healthcare measures that improve the general public health. Thank you for your interest in steatotic liver disease, your support in fighting this increasingly commonly disease, and your support to EASL to do so.
Hello, I'm Frank Murray. I'm a hepatologist working in Dublin, and I've been involved in advocacy activities in Ireland for more than a decade, and more recently in EASL. And I come today to tell you how important I believe that alcohol advocacy is. Alcohol kills about 1 in 2 patients whom we look after with liver disease who pass away, and also causes many other serious illnesses and deaths, and indeed causes close to 1 million deaths in Europe. The voice of the profession, or indeed the voices of the profession, have not been loudly heard. And I believe that we need to work together and form a European Alcohol Health Alliance to bring together the voices of the different specialties to make our voices heard with policymakers and government and the EU, with a view to implementing evidence-based policies to reduce alcohol harms. It's for this reason that I believe that hepatologists should get involved with advocacy. And I would encourage you to become active in your own jurisdictions and to perhaps contributing to EASL also in its activities to reduce alcohol harms. We simply cannot afford not to make our voices heard.
I am Loretta Condilli, hepatologist and clinical researcher at the National Institute of Health in Rome, Italy. There has been notable progress toward hepatitis elimination. However, despite hepatitis B vaccination and very effective therapies against chronic hepatitis C infection, the achievement of viral hepatitis elimination remains a challenge. It is important to advocate and foster collaboration across wide groups of stakeholders to achieve elimination by increasing innovation and joint working with empowered communities. For the physicians as researchers, it is important to understand they are actors for scaling up hepatitis case finding, diagnosis, and treatment, simplifying hepatitis responses. It is essential also to advocate and produce evidences useful for policies to convince politicians that spending money today to control viral hepatitis will reduce costs later by avoiding its complications.
Hello, my name is Richard Parker. I'm a hepatologist in Leeds in the United Kingdom, and I'm very pleased to be part of EASL's Policy, Public Health and Advocacy Committee. The incidence of liver cancer has been increasing across Europe over the past decade, where most cases will be driven by obesity, diabetes, alcohol, viral hepatitis, all of which are best tackled through good public health policies. EASL's PPHA committee is dedicated to supporting efforts to strengthen public health policies. It's increasingly clear that public health leads to better liver health.
Hello, I'm Matthias Heitmann, a consultant hepatologist in Scotland. With an overwhelming workload and pressures from a few conditions, it's easy to neglect rarer, for example, genetic or autoimmune diseases. These often require special knowledge and are difficult to manage. In primary and secondary care, people don't know enough about rarer diseases, and the patients often get a raw deal. That's why I feel that advocacy for these rare diseases is very important, to give the patients the same professional care they deserve as others with common conditions. This is important for equality and equity.
Hello, my name is José Willemsen. I'm a patient advocate and member of the Policy, Public Health and Advocacy Committee. Patient perspective is linked to the commitment to making care better for the patient, in our case, the patient with liver disease. I'm working to fill those gaps where the patient perspective is missing, so that we can say that liver patient care is approached from all directions and where the patient's perspective is clear. Don't hesitate to contact me or one of my colleagues if you want to know more about us and what we can contribute to your work for the liver patients.
My name is Jeffrey Lazarus. I'm the director of the Global Think Tank on Steatotic Liver Disease and MASH cities, and a professor at the CUNY Graduate School of Public Health and Health Policy and the Barcelona Institute for Global Health. I also chair the Healthy Livers, Healthy Lives Coalition, and I cannot emphasize enough the importance of working globally and of working with international organizations, be it patient organizations, professional medical societies, but also governments and intergovernmental organizations, multilateral institutions like the World Health Organization and even the UN General Assembly. We need to make sure that liver issues are on the agenda. We're not looking for exceptionalism, but we are looking for equivalence in order to end this public health threat.